We got an update about Sasha. Good morning, everybody. Um, First of all, thank you everyone for all the prayers, the support, the comments, the donations to the Hank and Eli's Fund. They're greatly appreciated. Um, uh, Sasha made it through the night, and she's doing incredibly well. Um, she basically had two surgeries yesterday. One of them was a open heart surgery, um, and as of this morning, all of her vital signs are what they were before they even did the first procedure yesterday. So she's been through hell and bounced right back. She's eating, she's drinking. Um, uh, a lot of Sasha's problem when we brought her down here was fluid retention because the right side of her heart's not working like it should, and it's causing a lot of fluid to build up into her abdomen and in her lungs. That's even reduced greatly according to the cardiologist. Um, they're using some diuretics, Lasix, and some other things on her, but she's shedding that fluid really well, better than could be expected. Um, Her breathing is still a little bit labored. Um, that could be Sasha. Sasha's just a nervous cat. She just is. When I'm not around her, she's just a bundle of nerves. Um, the cardiologist agreed with that assessment because she gave her a mild sedative this morning, and just enough to kind of take the edge off, and she calmed right down. She's interacting with the cardiologist in a friendly manner, grabbing her hand, wanting her to rub her on the chest. That's Sasha's thing. She likes to have her chest rubbed. So she's interacting really well. Like I said, she's eating. She ate a couple of meatballs last night around 10 o'clock. Um, she ate some this morning and took her meds without any problem at all. Some of y'all might have saw the video that Dr. Caitlin sent to us. Um, uh, she went out and went pottied. Um, according to Dr. Caitlin, she's peeing over a 10-row fence. So her kidneys are working, her liver's working, her bladder's working, all of her internal organs are working fine. She's quite frankly, this has been such a up and down roller coaster. We've had the highest of highs and the lowest of lows in the last few days, and there's no in between. She goes from on death's bed to possibly having a surgical recovery, and we're all excited about that. And then, and then the surgery didn't go as anything like we expected. Everything that could go wrong yesterday did, and we almost lost her on the table. She lost a lot of blood. She had to have 2 transfusions. They were able to, hey buddy, they were able to save her, but as a result, they couldn't complete the PDA repair, which is the main culprit that's killing her. We have some big decisions to make over the next couple of days. Um, uh, there's 2 courses of action. Not to proceed with a second attempt to the surgery, which could potentially prolong her life a couple of years. The other course of action is to not do the surgery and treat her with medications, but at that point we've got 2, maybe 3 months with her. So we as a family, and I'm including y'all in this too, help us make this decision. I mean, y'all love Sasha just as much as we do. Y'all have proven that, and so your comments are appreciated. Your input's appreciated. Any point of view, sometimes the outside can see in a lot better than the inside can see out. So we appreciate any input y'all might have. But I'm not going to let y'all know kind of which way we're leaning right now. We've got a lot to process, and a lot of water has to go over the bridge. So a lot of people are asking about what went wrong in the surgery. And the only way I know how to explain it is in her chest cavity, her heart is like this, and that PDA valve is like right down here. Well, her heart is really swole up. And when they went into the chest cavity to try to get to the PDA valve, the tissue in the main arterial artery from her heart is really thin, because although the heart's a muscle, it gets bigger, it can expand, but those other tissues and veins and whatnot, they stretch, but they can't really get any bigger. And so they're stretched to maximum capacity, and they're in a lot of places are very, very fragile and very thin. And so when they tried to get up under the bottom of her heart to get to that PDA valve to tie it off, somehow that main artery to her heart was nicked somehow or ruptured, and she could have bled out in just a minute or two. And I can't tell you, the team, the surgical team that was there has to be the Delta Force SEAL Team 6 of cardiac canine surgeons, because I mean they went in there and they saved her life in just when milliseconds counted. And I'm a pretty articulate guy, but I can't put into words how professional and how extremely good these doctors are, these veterinarians and specialists are at the Texas A&M Veterinarian Hospital. They are, people should be so damn lucky to have doctors this good. I mean, they're just phenomenal, and they really care. Hank's and Eli's Fund, I was really concerned about the expense of a second attempt. I was kind of doing some research yesterday while we were waiting for news during Sasha's surgery, and looking, and they're way up in the five figures. It's a very expensive process. And the Hank and Eli Fund, both guys that I've been talking to directly told me, don't worry about it. If the doctors want to do it, we'll pay for it. And so when y'all go thinking about donating to the Hanks and Eli Fund, that's the type of people you're dealing with right there. I mean, they could call it no joy and say, hey, you know, we put too much into this dog, and it's too much, which financially would make logical sense, but they didn't, and haven't, and they've been very supportive. Texas A&M University veterinary hospital the Texas A&M Veterinarian Hospital. They've even kicked in some funds somehow. I don't know how that works, but we were told yesterday that they're even taking a financial interest in seeing this come out and as a success. So very humble about that, and appreciative of that. Timeline. We've got to make a decision within the next 24 to 48 hours of what we're going to do, because if they're going to do the surgery, if we elect to go that route, they have to get back in there pretty quick before scar tissue is started to build up in there, and it makes an incredibly difficult operation even more complicated and challenging. We had anticipated hopefully being able to get her today. Of course, that's not going to happen. So Sasha's probably going to be in the hospital for another 2 to 3 days at the minimum. So that's kind of the timeline we're looking at. I hope I've kind of filled y'all in on everything. Overall, the prognosis and the outcome has been really, really good. We're really pleased with it. It's a 180 degrees today from what it was yesterday. So keep your prayers coming. Your comments and shares are really, really appreciated. I know a lot of y'all have donated to the Hanks and Eli Fund and Hank and Eli's Fund, and we deeply appreciate it. it's a very, like I said yesterday, regardless of what the outcome is with Sasha, this organization is incredibly worthwhile, and it's got to be one of the best secrets in the kept secrets in the veterans world, because I'd never heard of it, and I get around. I'm in touch with a lot of veterans organizations and a lot of vets and all over the United States and the world, and I've never heard of these guys. So get the word out there. There's vets out there that can use their services, and likewise, if you're looking to do something for your veterans, give a couple of bucks to the Hank and Eli Fund. That's all we've got right now. We'll try to do another update this evening and let y'all know. I've got a list of questions I haven't gone over, and I'm not going to in this video, but y'all keep the questions coming, and we'll try to address those at a later time. So we love you guys. Thank you for the prayers. Thank you for the support. And Dodie says she loves you, and we do. We appreciate everything. Sasha's got a huge fan club out there, and we're really humbled and appreciative of it. So we love you guys. Talk to you later.